Hey everyone, Dr. Sean Suda here from VIP Surge in Las Vegas, Nevada. What I want to talk to you about today is how to minimize your risks when you have surgery. So, surgery is scary for everyone, right? And your surgeon discusses with you the risks, the benefits, and alternatives. But what can you do as a patient to really bring that risk yourself down before surgery? So, there are several things. The first is kind of funny, it's hair. So, why is hair important? What you may know is that when you go into surgery, sometimes if you have hair occluding the area where they're going to make an incision, they shave you. If you have a scalp incision, they shave your scalp and so forth. What the studies have shown, at least for the past decade or 2 decades, is that when we shave hair and then make an incision, it increases your risk of skin infection. And that's because you have bacteria in the follicles of your hair, and the shaving process causes something called folliculitis. So the best thing to do is not shave, but that doesn't work for everyone because if you have a lot of hair on your abdomen, for example, you're like a bear or something like that, we really need to have space and we need to see in order to make our incisions. We don't want the hair getting into the incision. So we're gonna have to do something. The best next thing is clipping. So sometimes in the OR, they'll take a clipper and they'll clip the hair, but even that can cause a little bit of folliculitis, increased risk of infection. So what I recommend is that not 12 hours or 24 hours, but 2 to 3 days before surgery, if you are hairy and you know that's the area of your incision, to clip your own hair, but you want to take an electric clipper, not a razor, and you want to just run it over the hair without scraping the skin. So just get those long hairs out of there, and that will at least make the tall forest into a little brush or a little grassy field for the surgeon. They may do more shaving in the operating room, but this will help and it will decrease the risk that they're going to have to do a major shave job for you and increase your risk of skin infection. So what else can you do to decrease or minimize your risks of complications after surgery? Well, we know that 2/3 of the US population is overweight or obese. We do weight loss surgery and we do medical weight loss. The fact of the matter is a lot of people struggle with weight. Going into surgery, we know that if you carry extra weight, that does increase your risk of complications. It can increase your risk of heart problems, lung problems, skin infection. It can make the surgery more challenging for the surgeon depending on what kind of surgery you're getting. So the best thing you can do prior to surgery, let's say you're getting an elective gallbladder surgery or bariatric surgery, is try to lose a little bit of weight before surgery. A lot of times before bariatric surgery, we do something called medically supervised weight loss. And we like to see people lose a certain percentage of the weight going to surgery because it shrinks their liver, which holds a lot of sugars and fats, and it really makes the surgery less risky for us. You don't want to gain weight. So how do you lose weight before surgery? What the studies show is that if you do a very focused weight loss program for 2 weeks prior to surgery, and that's often a protein shake diet with a regular sized meal for dinner. So protein shake for breakfast, protein shake for lunch, 1 or 2 for snacks if you really need them, and a reasonably sized meal, let's say 500 to 800 calories, you will lose about 9 pounds in those 2 weeks. And if you do that, we know that if you have fatty liver, that can reduce your liver size by up to 40%, just that little bit of work that you do. And that can make it easier for the surgeon to get around in your abdomen. So weight loss, not gaining weight prior to surgery, will definitely decrease your risks of surgery. What else can you do to minimize your risk of surgery? Well, smoking. Now, very few people that I know smoke tobacco cigarettes like they used to, 20 or 30 years ago. But if you do smoke tobacco cigarettes, you can almost guarantee that you're going to have a higher risk of complications. There are certain operations, like plastic surgery operations, lung and heart operations, vascular operations, that if you smoke cigarettes prior to, during, or after surgery, you're almost guaranteed to have complications. For other operations, it highly increases your risks, both for your lung, from an infection standpoint, from a heart standpoint. So you want to stop smoking. Even if you stop smoking 3 days before surgery, the studies have shown that it still confers an advantage in decreasing your risk. And you definitely don't want to pick it up right after surgery. It's a good opportunity to consider quitting, so talk to your surgeon about resources that you can use to stop now, to quit smoking. It's a good opportunity going into surgery. Some people ask, well, what do I do if I smoke marijuana cigarettes? Or what do I do if I smoke marijuana? Well, we don't know the true answer to this. We do know that it's probably not as risky as tobacco cigarettes in terms of the complications that we know tobacco cigarettes cause, but it's probably a good idea, at least from a lung standpoint, to cut down or to quit right before your surgery and right after your surgery. What else can you do to minimize your risk of complications after surgery? If you have diabetes, blood sugar control, strict blood sugar control has been shown to really decrease your risk of complications, particularly infectious complications after surgery. So if you know that you're a type 2 or type 1 diabetic, you want to keep that blood sugar as controlled as possible. See your internist, see your endocrinologist, and make sure that you take the medications you need, you do the dietary things you need and lifestyle things you need to keep your blood sugar as tightly controlled as possible. And they will help you to do that at the time around surgery because we know it decreases your complications. So that's all the things you can do as a patient to decrease your risk of major complications after surgery.